Welcome to Get Moving TV. I'm Dr. Chris Landon and I serve as your host. I came to Ventura over 30 years ago to start the Pediatric Diagnostic Center here in lovely Ventura, California. Didn't really start that way. It just turned out I was the only pediatrician serving Ventura County Medical Center. The patients clearly who were using the services had terrible distress. They had to come in 2 and 3 buses. Both parents are working. We had problems with gang warfare over in Oxnard, California. And so we spent the next 30 years really trying our best to improve the social atmosphere. Dr. Paul Russell was very much involved in child abuse prevention, particularly parents who had previously abused each other. These children are at even more risk. So it gives me great pleasure to bring Sharon here where we can have a conversation about really where you fit into all that. When you came, I think I first met you as a graduate student at UC Santa Barbara. I have an interest in autism and
Right.
Didn't take much. So tell me about your career, because people who watch this show, gosh, I want to go to college. What should I do? And so you started out as a banana slug?
Yes. Yeah, my starting point is not where I am currently, so absolutely right. My undergraduate career started at UC Santa Cruz, and that the mascot of Santa Cruz is the banana slug. So still proudly call myself a banana slug. And at the time, I was studying sociology. I was really just interested in how, I was thinking I was going to go into social work, so interested in how societies were affecting our families and our children. And just over time, realized that maybe that wasn't the direction I wanted to go in. So my next leap was to Pepperdine University, where I thought I wanted to do clinical psychology. So I actually have a master's in clinical psychology. And once again, kind of felt like that maybe wasn't the right direction, that I wanted to be more specialized. And my interest for a long time, in particular because it had been an area that my mom was involved in, was working with children with developmental disabilities. So my final kind of leap in my higher education was at UC Santa Barbara, where I was in the doctoral program for educational psychology with a specialty in what they called special education, disabilities, and risk studies. And particularly at the time, I was focused on autism and children and adolescents with autism, and specifically on behavioral interventions to work with those children and their families. So that's where I landed. And then as I was doing my doctoral program, I realized too, one of the things that was challenging was for families to actually access services. So there were a lot of families who weren't getting into those behavioral interventions until children were a little bit older, so 5, 6, 7 years of age. And we knew from the research that actually we could identify children much sooner than that. So my interest started to veer more towards like identifying kids as early as possible. And so working with our pediatric community to really implement developmental screening protocols, to screen for autism, and get those families linked up as early as possible so that they then would also be able to access services.
So I started out way back in the late 60s, I guess, early 70s, where we were using shock sticks at Camarillo State Mental Hospital to get things going. Then we moved to M&Ms, which was kind of nice, and that has certainly evolved out of UC Santa Barbara. I think your training is a lot different. We worked here in Ventura County on really training doctors in the ages and stages questionnaire and the peds, and really trying to get that down, because so oftentimes your pediatrician will say, oh, Einstein didn't talk until he was 3. So we really have been able to push through programs that you've been involved in, that just screening for communication down to 16, 17 months. These boys are so mad when they can't talk and they want to talk. They'll just punch people out. So there's a lot going on. So with your training program, that was oriented towards really family medicine residents. And how did all that go?
Yeah, I mean, you're absolutely right. I think we've learned a lot, I think, the last 2 to 3 decades about how to intervene for children who may have developmental disabilities, including autism. And I think we are much better at also figuring out how to identify those kids early. But you're right, even to this day, I think there are still people who are in practice, physicians as well as psychologists and others in the field who take that kind of wait and see approach. And so I think there's still a need for someone like me to do the work that we're doing. But this is, as you know, this is how I met you, because as I kind of was moving along my graduate career, again, looking at how do we kind of maximize the opportunity early on for children. And it is the physician, whether it's a pediatrician, a family medicine doctor, who families trust and where families actually go when they may have a concern or not have a concern, right? And so hopefully that professional is able to see that. And so my dissertation was really on working with physicians to create those protocols, to figure out how, when they have a child for only a small amount of time, can they implement certain protocols in that pediatric setting or the family medicine setting to not only say we might have some concerns about something, and then also do the follow-up and link them to something appropriate.
So I think the hard part is if you're a pediatrician in a carriage trade practice, you're seeing something 1 in 100. While when there's these social determinants of health, when there are extra problems, when we're trying to provide the children with a different environment and pick up problems earlier, that maybe we get a skewed version kind of the other way. Certainly most physicians base how they practice on the last 10 cases they've seen, and they've seen one case of meningitis, oh my God, the next 10 kids with headaches have meningitis, and so forth. Well, is there a national movement now towards really this seeking a safe environment? What's happening with that?
Absolutely, and I think, what I was mentioning about my early work, it's very focused on children specifically, right? And I think what we're seeing in the last few years is the recognition that children don't live in a bubble, and their experiences matter, even very, very early on. We're talking potentially even prenatally and in infancy, that what they're experiencing is going to impact them, whether it's developmentally or through health outcomes. So I think just with a lot of research that's happening in the United States in particular, where we're seeing that, it does matter, like you mentioned, things like poverty or traumatic experiences like domestic violence in the home, that all of those things have the potential of affecting that child. And so if we're looking to address some of that, we need to be addressing the family unit. And so there is a movement, in particular I would say in medicine, through pediatrics and family medicine as well, to say, how do we now, we've done the part about developmental screening. You mentioned the Ages and Stages questionnaire. We do the MCHAT, which is a tool looking at autism specifically. But how do we now go beyond that in some ways and start incorporating other features where we can look at more of the family environment and how that's impacting the child? And so absolutely, there's a big movement. And in particular, I would say in California, we're very lucky that there's a lot happening there as well.
Well, we're going to talk about the ACES program a little later. Nationally, I think there's Dr. Dubowitz, who is pushing the SEEK program.
Yeah.
And a lot of my pediatricians go, oh boy, I don't have time to do anything anymore.
Yeah.
How can I add in one more thing to that? So you've interacted with his group. What do you think about their program?
I have. Well, I'm biased, but I think it's amazing. And I can tell you a little bit more about it. I think the nice thing is we have these really, really smart people, these researchers who are doing the work at universities and piloting programs and doing these research studies that are very applicable to the real world. And so Dr. Dubowitz is one who's at the University of Maryland and has done some research on how do we translate what's happening at the university and research level into everyday practice. And so he does have a study out right now, actually, that's called the SEEK study, which stands for Safe Environment for Every Kid. And in fact, they are looking to recruit physicians, both pediatricians as well as family medicine physicians, to participate. Some of the features of this program are that there actually is a particular questionnaire that physicians can use in their practice that is pretty short and is something that the parent fills in. There is training that they can access through this study to guide them. They learn techniques about motivational interviewing, how to score the questionnaire. But the other nice part is that doesn't just end there. It actually provides some resources. So there is a hotline where they have access to a social worker, and the researchers work with them to figure out how locally also there may be some resources that they can access, as well as some instructional handouts that could be provided to the parent.
Yeah, I think that's the hardest thing for my pediatricians to go, oh my gosh, how can I cram one more thing in there in terms of, and spend time and on the phone and trying to find these resources. Right. But the impact is tremendous in terms of asthma, diabetes, all these other portions about healthcare where if you're not looking at a child's environment, when we did a study looking at pediatric intensive care units, and most of those kids were actually the children of the grandparents were the ones who were there. It wasn't the regular family. So there's other impacts on healthcare other than just what's happening in the home. But how does it work then? So they're taking a questionnaire, and do they score it? And
yeah, the workflow is similar to what we've done with other screening protocols. This one is a little bit prescribed because it is part of a study, and so we're looking to see how does that workflow actually work in a practice setting with working physicians and their nurses and their medical assistants. So yeah, absolutely. So the questionnaire is filled in by the parent, the physician scores it, the results are reviewed with the parent, and again, they've got some training in how to do that and do that in a positive way. And then if concerns are identified, again, hopefully there's been some work ahead of time so they've identified some resources that they can immediately provide that to the parent. So it doesn't just end with you filled in a questionnaire, we've identified something, but there's an outcome to that, which is here's some places where you can get support and here are some informational materials. So the whole process itself, I think once it gets going, can be relatively quick. And in fact, the study, Dr. Dubowitz has done a couple of different studies already on this and has found that it does not add a lot of time to that visit. And that families are really open to participating in the process.
Well, I think that's really the direction we're trying to head in, and that's family-centered care, that it's not just that child in there to get an immunization and, or is he speaking yet, but really that they are going home to an environment, and then also co-production of care, that you're working with the family to address issues or directions or answers or whatever they need, but you're working together with the family.
Absolutely. And I think there's much more of an expectation from parents that is part and parcel of kind of when they come in for a visit. It's not just now about your vaccinations and checking a child's height and weight, but that there's other things that come along with it. But as I mentioned, this study in particular, they've had a lot of success in physicians' offices. So right now, there's actually an opportunity for any physicians who may be watching who work with children and families to participate. They are recruiting to the end of this year to incorporate practices across the United States who may want to participate in the study. There's a small stipend attached just to do a little bit of the work that may be required. But I think the biggest part of participating in something like this is that it offers the opportunity to get trained on this kind of while the iron is hot in a way, right? There's a lot of talk about this. Again, there's expectations from families. We recognize that there's an impact on health. And so this is an opportunity to kind of participate in something at the ground floor and get the information and resources to really improve quality patient care in the pediatric setting.
Well, very good. Well, we're gonna take a little break now, and Ventura, we're going to be right back. Welcome back. Well, I'll return to our discussion with Sharon about all the things that are really in place. One of the things I wanted to cover kind of quickly was just the resources. That's always a concern. We have, you're associated with FIRST5 of Ventura County. You've been with Landon Pediatric Foundation. We started the Help Me Grow project.
Yes.
And can you talk a little bit about those and how they can be resources for families and for physicians too?
Absolutely. So yes, as I alluded to earlier, I started my work with you, and at the time you had a contract with FIRST5 to develop an initiative called Help Me Grow, which is actually a national initiative that is really around identifying kids early and linking them to services. And so it's a very simple kind of mission, but it involves a lot of components because obviously, as we've already talked about, physicians are a really important part of this process, but so are early childhood educators like our preschools and so on. But FIRST5, which in many of our counties in California is really the lead for Help Me Grow, took on that initiative this past year. And so that's where I am right now. And FIRST5, for about 20 years now, has been a leader in pulling together local resources and making sure that our children, specifically children 0 to 5 and their families, are able to connect to important things related to development. So whether it's childcare, classes to help support the parent-child relationship, developmental screenings, and also providing a lot of training to our physicians and some of our other providers in the community about how to link our families. So it's really a system-wide approach, both from FIRST5 and then specifically around the Help Me Grow initiative, which I'm a part of.
And we'll talk more as time goes by about other resources. Ventura County Community Foundation helps to support the 211. And so we really want pediatricians to know that these resources are available for them, and family medicine doctors as well. So Ventura, that's our little public service announcement. We're going to be right back. Ventura, welcome back. Well, we're going to be talking about ACES with Sharon. We really, both of us have participated in some of the training. And we're going to talk how it's very important for your pediatrician or family medicine doctor. But as a community, you need to know what these adverse childhood experience screening means, that there is life beyond ACEs here. So you participated in the webinar. Can you just kind of talk a little bit about what's been covered?
Absolutely. So as you mentioned, ACEs are adverse childhood experiences. We've known for some time that there is an impact from those early experiences to children's outcomes. And there is a movement in California in particular to make sure that we're screening children for ACEs. And so our state has put out some really cool trainings actually about how, starting off in the pediatric and then family medicine setting, how to screen for ACEs and also link families to the supports that they may need. And so the trainings as they exist right now are online. And the nice part is that it really walks you through different scenarios of what might happen if a patient comes into that setting, and how to kind of not only screen and actually use a screening tool, but how to have the conversation with the parent or caregiver who may be there with that child about the screening tool.
Well, that's what I see lots of children for asthma, of course, and that's always been part of my question, because are you able to get your medication? Can you afford it? How did you get here? You were on 3 buses. Where's Dad? Oh, he's on vacation, which means he's in prison. And how does that impact? We took a look at the gangs in Oxnard, and had a gang injunction, because what we saw is the kids were trapped inside their apartments. They couldn't get out, so mold and cockroaches and dust mites became a much larger problem. But it's not just lower socioeconomic. There are impacts of drug abuse in the family and so forth. So what are the 10 categories that are really screened?
Yeah. Well, I think you're right on. I think it isn't just those things that you mentioned. And we know this because there was actually a seminal study that happened in 1998. So it's been a little bit of time, but it was run by Kaiser Permanente down in San Diego, along with the CDC, the Center for Disease Control. And what they looked at was, they asked adults to look back in their histories and see if they were impacted by anything adverse experiences. And out of that study, they found that there were 10 particular life experiences that led to poor health outcomes. And they actually were looking at physical health outcomes, not just kind of mental health outcomes. And what they found is that in the 3 categories, one being abuse, so physical, sexual, emotional abuse, neglect, both, again, physical and emotional, and then household dysfunction, which includes, among other things, like divorce and domestic violence, and so on, that those 10 particular ACEs had a really big impact on those health and behavioral health outcomes for adults. The interesting thing about that study as well is, because it took place primarily in San Diego, is that the population that participated in that study were about 70% Caucasian and 70% college educated. And so we know that this kind of runs across people. It's not just for our low-income communities, although we see a higher prevalence, obviously, with some of the things that they're having to deal with, but it really does matter to almost anybody. Anybody out there could have ACEs.
Yeah, I was trying to count them up before we started, and my parents are divorced, and my mother was in prison in Guatemala. So there are certainly some things. Maybe that's why I became a teenage rebel and became a doctor. I could have been, a singer or songwriter, but
Absolutely.
no, I had to have adverse childhood experiences.
Yeah.
And well, so can you rebound from them? I mean, that's the...
Yes, we absolutely can. And I think that is the important lesson here, is that even though there's probably people with ACEs, and in California they've done some studies to show that about 60% of Californians have about 1 ACE, and about almost 18% of Californians have 4 or more ACEs. And the 4, it matters because that's usually the cutoff when we start saying, maybe we need to help with something, whether that's an actual intervention or support of some way. But that's the key, is that we can intervene. And so this is why we want to identify this as early as possible so that we don't have those poor health outcomes. But we can absolutely intervene and address those ACEs.
So so intervening early or late. They're screening for ACEs in the adults as well, because they know that for diabetes and obesity, hypertension, all these disease states, it makes a difference. Okay, your turn.
Yeah, so the way that it's being implemented right now is that absolutely we're looking not only at children, we're also looking at adults, because again, in the original study, it was like past experiences mattered, right? So for young children, we want to intervene so that we don't have those outcomes. But for adults, there's the potential to say, because you've had those experiences, this is maybe why you're experiencing these things, and let's see if we can impact that now. But again, the key here is that it's not your destiny. And one of the nice things that's happening in California right now through our Office of the Surgeon General, Dr. Nadine Burke-Harris, as well as our Department of Healthcare Services, is that there is an initiative called the ACES Aware Initiative that is spreading information about ACEs and how to intervene in the medical setting, and actually putting some money behind it to make sure that it happens.
I think, as we look at the 10 questions here, 0 to 3, you're doing fine.
Yeah.
4 to 7, we need to really spend some time and explore. And 7 to 10, it's really time to get things going, because again, it has that big impact on diabetes, on asthma, on taking your medications, success in school, and whatever it takes. So you don't want to have the pediatrician just going, well, we're done here. Here's your shot. See you later. Oh, you're overweight. Well, if I have a 300-pound 18-year-old, there's a good chance that she may have been sexually molested or has had some adverse experience under the age of 10. And that's where we need to intervene. It's not just about diet. It's not just about too many sodas anymore. It's about her life. Yeah,
and I think something I didn't mention is that it's not just about the numbers. And so I don't want people to walk away thinking, okay, if we've got a high ACE score, oh my gosh, my life is ruined. That's it, we're done. Or my child has a high ACE score and that's over. Because again, we can buffer that. But the studies that are looking at ACEs that have since looked at ACEs since that original 1998 study also said, even though you might have a high ACE score, as long as there's a buffering effect of a supportive adult, that still will ameliorate those outcomes or those symptoms. So it really is about building, if we're talking about children in particular, which is obviously the area that I'm interested in most, is those children 0 to 5, is even if we're discovering that they have a high ACE score, as long as we can build up that parent-child relationship or the caregiver, whoever is there around that child, if it's in place, can we support it? Then there's the possibility that we won't even get to those poor health outcomes, that we are not developing diabetes, that we're not having some of those other like behavioral health issues as well. So it isn't just about the score. So I think that's an important thing to kind of highlight, is that even if it happens, there's lots of things we can do, from simply supporting that early relationship to, for some people, maybe it means actual like therapy or intervention.
It's at my Rotary just this week, and we had kids and family together there, just really talking about the services, which is really all about the family. It's about for kids who are in foster care, finding that potential kidney donor and just even an aunt and uncle, just something that they're connected to. It makes a tremendous impact on their personal life. So with the ACES Aware Initiative, if my pediatricians and family medicine doctors are certified, there is a 2-hour online course. I think the other piece of it is how it affects me. I mean, my gosh, I'm asking these questions now, and as I'm thinking back on it, it was not the most. It was certainly an interesting childhood when my parents were screaming and fighting, but I did find a supportive family elsewhere, and mitigated my life experience, and here I am today. So as we find these extra services and find these families, we're also being paid to do these things.
Yes, and so
compensated.
Absolutely. So as I said, the California as a state has decided that this is a priority, that we can really impact our children and the future of our children by participating in this initiative. So as you mentioned, there are trainings right now that people or providers who are working with the Medi-Cal population can take, and then they can actually bill to do the ACEs screening in the well child visit or in the pediatric setting. But along with that, they are also building out the resources. So it's not done in isolation. So it's not just about the screening. Again, it's not just about the numbers, and I really want to make that clear. But that what we're looking at right now, in particular the work that I do with FIRST5 and under the Help Me Grow initiative, is saying, we know that this is coming down. We might be identifying children and their families, because our children are not in isolation. And so what do we already have in place, and what other things can we really promote so that there is some place for these physicians to send their patients? And that's a big push of this initiative as well. It's not just the screening part, but that we're building out the resources in the community to help these families.
Well, yeah, and you and I have worked with the American Academy of Pediatrics, Chapter 2. They're certainly going to take on San Bernardino County and Riverside and LA County and so forth. Our public health department is going to be partnering with the other public health departments up and down California. And then I'm hoping that we're funded really to put in place what's needed to make the community aware.
Yes.
Meetings at Rotaries and Kiwanis and Lions Club, when you inform one person and you say, gosh, you're a grandparent and your grandchild's staying with you, well, why is that? You have permission to let other people know, and the impact that you're going to have on that child by being that person, by providing that buffer.
Absolutely.
Okay, so from here, where do you see FIRST5 going and the like? So is there an initiative inside FIRST5 where you guys are discussing this? And
we are, and I think it's happening statewide. So as people may or may not know, that FIRST5s are in every county in California, and so we're part of the larger conversation along with at our state departments about how we're going to support families, because initially that's why FIRST5s were set up, is to support the family. So this is really in line with what we've been doing for the last 20 years and really fits in with what the current research says. But FIRST5s are going to play a role in partnering with physicians like yourself, with public health agencies and so on, to be that connector role and make sure that families are accessing these services.
Thank you, Sharon, so much for sharing your wisdom and strength and hope. And Ventura, get ACES aware. It's coming. It's here. It affects your health and those in your family.